Hello and welcome back to your favorite 11 o'clock news hour. My name is Carlos Weise, and in the news today we have a recent outbreak of hand, foot, and mouth disease in Southeast Asia. Barbara?
Yes, hand, foot, and mouth disease is caused by an enterovirus. This virus is named Coxsackie virus, and it is in a family of the polioviruses. It is named after the city in New York in which it is first isolated. To tell us more about this virus, we go to Carlitos in the heart of Southeast Asia. Carlitos?
Hello, my name is Juan Guadalupe Hidalgo Ortiz Gomez de Santiago, pero my amigos call me Carlitos. I'm here in the south, in the heart of Southeast Asia, where there is a massive outbreak of hand, foot, and mouth disease. Transmission occurs by fecal or oral routes, contact with skin lesions, and oral secretions, including coughing and sneezing, and also sharing utensils such as forks and spoons or cups. That's disgusting. Health officials have seen a significant increase in hand, foot, and mouth disease cases reported during the first half of 2015. Cases have gone from 180 reported cases in 2014 to 563 and just by the end of June. And that's just here in the Philippines. Hand, foot, and mouth disease occurs worldwide, as seen with the recent case of hand, foot, and mouth disease that has affected 19 American students here at Princeton University. Hand, foot, and mouth disease has a transmission risk of 10 to 30%, which is moderately infectious, so epidemics can occur. I asked everyone to follow proper hygiene, as there's no vaccine. Back to you guys.
Thank you, Carlitos. It looks like hell out there. Now for a little insight on the signs and symptoms of hands, foot, and mouth disease, we have on set our own medical doctor, Dr. Juan Carlos. Dr. Carlos?
Hello, I'm Dr. Juan Carlos, and I'm here to tell you about hand, foot, and mouth disease, how to prevent it, and what to do when you get it. Hand, foot, and mouth disease looks like a mild rash on the hands and feet and may often cause sores in the mouth. It often occurs in young children and young adults, but may also occur in the adults and maybe even the elderly. The virus that causes hand, foot, and mouth disease is commonly found on the surface of the skin, so washing your hands and maintaining good hygiene is a must. Using disinfectants on common household items that are frequently touched, like doorknobs and remotes, helps kill any lingering organisms. And if you or loved one may seem to have these conditions of hand, foot, and mouth disease, it'd be best to isolate them to not transfer to anyone else. Treatment for hand, foot, and mouth disease is a very simple one because there isn't one. Waiting is the best treatment because any signs of hand, foot, and mouth disease are usually gone within days and in extreme cases up to a few weeks. To alleviate some of the discomforts and pain that come with hand, foot, and mouth disease, one might try topical ointments or anesthetics and maybe even pain relievers. And I'd also stay away from spicy food. This has been Dr. Juan Carlos with your daily health update. Back to you guys.
Thank you, Dr. Carlos, for your medical insight. I'm Carla Carlitos.
And I'm Carlos Luis.
Join us next time on HFM News, where we dive deep